Hello everyone, I am Dr. Pratyusha, consultant psychiatrist at Child and Adolescent Guidance Clinic, Access Psychology. We have started this center with an aim to focus on the psychological well-being of children because this is the phase where rapid growth and development takes place. They acquire the cognitive and social emotional skills which are required for their future. Statistically speaking, children constitute about 1/3 of the entire population, and 20% of these individuals have had some kind of a mental illness even before the age of 14 years, and 70% of them go almost unaddressed and unidentified. Identifying the problem at an early age and addressing is important because it helps in improving their learning outcomes, school performance, the social and behavioral adjustments, and overall growth. So what are the most common psychological conditions we see in children? They can vary from developmental disorders we see in childhood like autism spectrum disorder or specific learning disability, intellectual disability, or speech delays, both expressive and receptive, or some behavioral conditions like ADHD, that is attention deficit hyperactivity disorder, defiant and stubborn behaviors like oppositional defiant disorder and conduct disorder. Also we see when the transition phase like adolescence from childhood to adulthood, they have adjustment disorders to the mere adolescence, which further leads to some kind of a depression or anxiety. Also addictions are most common in adolescence, both substance use disorders and behavioral addictions, substances like alcohol and cannabis. And coming to behavioral addictions, where we can see in the last 2 years in a pandemic situation where the whole world is going virtual, these addictions are increasing in children like internet, gaming, and gadget use disorders. So basically addressing and identifying conditions in children and adolescents is a complex phenomenon. So here in our center, we employ an integrated and comprehensive team-based approach where we have experts from different areas. So our team includes a psychiatrist, a clinical psychologist, a speech therapist, an occupational therapist, and a special educator. Through this team-based approach, we offer global assessment of the problem, evaluating and assessing the situation, offering parental counseling and addressing their concerns, and evaluating the progress at regular intervals. I believe that children are the building blocks of future, and it's our responsibility to guide them in the right direction. Thank you.